Session number 13, Impressions and Pouring of Impressions. We will be making maxillary and mandibular PVS impressions of your typodont with edentulous spaces in the 5 and 20 areas. Insert the following teeth: number 4, 6, 19, and 21. Make sure that 19 has a fixed gold crown prep finish line. We will use orthodontic bands You will cut those with a pair of scissors, and we will use that as a retraction cord so that we can retract the soft tissue or the shroud that we have in our teeth. Use a plastic instrument and put that in between the teeth and the soft tissue. And slowly start with one end and put that retraction cord or our rubber bands in between the soft tissue and the tooth. As you will be going around, you have to push hard. And as you can see, we're going into the interproximal aspect, always making sure that our finish line is visible. This will make our impression much easier. Once you have finished doing that with all teeth, make sure that the finish line can properly be visualized. If the retraction cord didn't help enough to remove that soft tissue, like for example on this canine, you can use a red handle knife and cut off that shroud. Be very carefully and very slowly remove that part that you couldn't retract with the rubber band. Here you can see that we're having a fulcrum with the finger so that the blade doesn't go all the way around. And carefully remove that part that you think is not letting you visualize completely the finish line. Here you can see, once we have done that, it's properly visualized. We will also be using rope, red wax, that we will be putting interproximally. We do that so that the impression material doesn't get locked in and so that impression material doesn't flow in. We will be now selecting a proper sized impression tray. Make sure it's seating properly. We will practice the seating of that impression tray, and then we'll start to apply the VPS tray adhesive. Pour some of that tray adhesive in a dappen dish. Use a cotton tip applicator and apply that in all surface areas of the impression tray. Once you have done that, you have to wait approximately 5 minutes until the VPS tray adhesive is dry. We will be using Aquacel monophase, and we will be using two consistencies. One will be light bodied and the other one will be medium bodied. Make sure you know which one you're using. When you load the cartridge into a gun, you can lift that lever, and in the back there's a release button that you will have to push so that you can push the plunger in and out. Align the notch of your cartridge with the corresponding notch of the gun and lock that in place. Now you can push the button and push the plunger all the way in. We have to bleed the cartridge first, so we will slowly squeeze a little bit until both the catalyst and the base come out on the same time. For the light body, we will be using a Kerr free flow syringe. And as you can see, it has a plunger as well. We will remove the tip and make sure when you remove the tip that you cut off the tip with a pair of scissors so that you have enough material flowing through. Working in pairs, have one person load the impression tray with the monophase impression material while the other person injects the Aquacel around the preparations. Begin by placing the tip of the impression gun interproximally with the tip in contact with the tooth in close proximity to the margin. Cover the entire axial surfaces. Do not lift the tip of the tooth and do not stop the injection. Once you have finished, you will use the ear syringe and blow forcefully in such manner to spread the PVS into a thin layer that you can see is covering the entire preparation. Re-inject the Aquacil to cover the prepared tooth and the occlusal surfaces of the adjacent teeth. Once you have that, place the loaded tray over the teeth and seat it. Hold the tray until set. Now we will be pouring up the impression. Once you have evaluated your impression, we will use the bubbleizer to break the surface tension of the impression material. Make sure you remove the excess. You can also use a syringe or some air to blow off the excess. We will be using jadestone to pour this impression. We will use 70-gram packets that will be mixed with 15.5 ml of water. We will pour first the water in and then the content of the 2 jadestone packets. We'll be using the vacuum mixer. As you can see, we'll vacuum mix that exactly for 20 seconds. We'll also be using a bench vibrator, and make sure that you adjust the vibrator to the correct amount of vibration. Use a very small amount of the jadestone and place it close to the prepared teeth. Let the stone flow slowly into the prepared teeth, making sure that you don't have any voids or bubbles. Once you have covered the prepared teeth, you don't have to be as careful and you can go slightly faster. Make sure you have enough as for a base, and you can use the vibrator for that as well. Once you have waited until the material sets completely, make sure you use a buffalo knife and try to insert that in many places until you can slowly see the master cast is being removed. Don't apply too much force and try to be patient. Be very careful with the cast that you just poured up. If you're not patient, you might fracture one of the prepared teeth that you already have done. Once you have that, make sure you evaluate that impression and make sure you don't have any voids.